Okay. Yeah, it says that, but I hadn't started it yet, so I didn't wonder. Okay, I have 3 o'clock, so we are going to get started. I'm going to go from there. Welcome, everyone. This is Mercedes Bern-Klug. I'm at the School of Social Work, and I'm also the coordinator of the University of Iowa's Aging and Longevity Studies program. Came back to that last month. I was away for a couple of years while I was the director of the School of Social Work, and now I'm back to my faculty position, which I love. I love being a faculty member and not an administrator, and back with the Aging and Longevity Studies program. Um, Happy United Nations Day of Older Persons. We have been celebrating this day for about 20 years here in Iowa City. The Aging and Longevity Studies program started doing it with our local senior center and the Johnson County chapter of the United Nations Association. And then the Some Center with the College of Nursing also has been involved. So some mixture of those four groups every year puts on something to do with the UN Day of Older Persons. And so, welcome to our first Zoom meeting past the pandemic for the UN Day of Older Persons. And I also want to do a shout out to the United Nations Association Johnson County chapter for co hosting this event. Um, we also have a big day today, in addition to the UN Day of Older Persons. It is Jimmy Carter's 100th birthday today. And so we'd like to honor the work he has done nationally and internationally on behalf of people of all ages, but he's also done a lot of work geared toward older adults. He's part of the Elders, a group started by Nelson Mandela, working on international aging issues. And of course, you know, he's a former president of the United States and a winner of the Nobel Peace Prize. He helped eradicate guinea worm, which was a parasite killing people, and is very well known for his many years of service. He and his wife Rosalind for Habitat for Humanity. So, happy birthday, Jimmy Carter! I'm going to switch over now to our speaker, and we've got a pretty interesting topic. And I'll tell you from my conversations on the phone with them, a pretty interesting speaker as well. Dr. Kenneth Goodman serves on the World Health Organization's group for artificial intelligence and health. And I know that everybody's been hearing an awful lot about AI, especially this last year and especially this last 6 months. And on campuses throughout the country, we're getting all these instructions on how to deal with AI in the classroom. So I'm looking forward to hearing what Dr. Goodman has to say about the potential for ageism or age bias in healthcare with this introduction of AI. Dr. Goodman's the founder and the current director of the University of Miami School of Medicine's Institute for Bioethics and Health Policy. And this institute is one of only 14 in the world designated by the WHO as a collaborating center in ethics and global health policy. And Dr. Goodman's center is the only one in the US. He's going to talk about AI, artificial intelligence, and he's been part of a committee that helped to develop a report for the WHO on artificial intelligence and healthcare. So with that, I'm going to ask everybody to mute yourself and please remain muted until Dr. Goodman's presentation is over. He's going to talk about 45 minutes. Then we'll open it up for questions. At any point, you're welcome to put a question in the chat box. We'd love to see that. And then I'll keep an eye on the chat box, but Dr. Goodman's not going to be able to see the questions while he's presenting. And then when he's done, we'll go ahead and go through the questions in the chat box, or you can unmute yourself. So let me go ahead and mute myself. And Dr. Goodman, take it away.
Dr. Bern-Klug, thank you so very much for that generous introduction. This is a privilege for a bunch of reasons, which I hope by the end of our session, you will appreciate why. Those of us over a certain age have a sense of history of the world, of our country, and of all the things that can go right and wrong with both of them, especially given the news of the day. When I sit at my desk, I've got all these monitors and screens. But I have a bunch of newspapers. I actually pay for newspapers. The news of the day is terrible. There's a war that's spreading, and war is not good. But you'll remember the League of Nations and the origin of the United Nations. And for all the troubles that it manages, including some of them that are internal, I, for one, cannot imagine a world without it. As difficult as things sometimes seem, at least there is a forum where people can get in the same room for a little while without trying to shoot each other. And that apparently has become a virtue on Earth. So you're dealing with somebody who has great respect for and sympathy for the United Nations, fully mindful of the fact that a lot of people who can't think of enough things to criticize it for. I'm going to be sharing a few thoughts with you. I'm going to turn out some slides in a minute. Just between us, I actually heard someone, if you read about the history of the Iraq War, the war in Iraq, recall that was the effort to try and find weapons of mass destruction. They didn't find any, and it was a silly, sad war. Most wars are silly and sad. Some of them are even stupid. But apparently all the important data, all the facts that they were reviewing were in the notes field of a PowerPoint presentation. And it was in the notes field of a PowerPoint presentation that basically undermined the arguments in favor of the attack on Iraq. You can Google this or no trade names, use your favorite search engine to look up PowerPoint Iraq weapon. And you'll actually see there's a small literature that shows that the whole thing was. So I blame PowerPoint for that war, at least. Nevertheless, it is among the ways we like to communicate. And I am going to share a few slides with you. If I push the right button, like that. Are y'all seeing what you're supposed to be saying?
We see it just perfectly. Thank you.
Look at that, just like Uptown. See, normally you do it the other way around. I kept it going so I didn't have to restart the slideshow. That's my email address. Please feel free if you have questions afterward to reach out. The United Nations does a lot more stuff than try and prevent war or stop it once it's started. And one of the things I wanted to draw your attention to, especially in the context of artificial intelligence, which is what the WHO was trying to be mindful of when it was as it's doing its work on AI, namely sustainable development goals. I'm not going to read them to you, but I'm going to shut up for just a second as you look through these. I think there's 17. Right. In other words, it has become clear that the way things are going in the world can't continue like this forever. At a minimum, we've got problems with terrible storms. We have problems with water. We have problems with sea temperature and sea rise. Oops, I hope that's not too woke for y'all. Anybody who tells you there's not a problem with climate change is lying to you because they think you're stupid enough to believe them. And if I say anything that offends anybody, sorry. No, I'm not really sorry. I'm sentimental about science. I actually know a little bit of it, and you all know a lot more than I do. Whenever someone starts telling you without any background expertise or education whatsoever, they know more about environmental science, more about vaccinology or immunology, or that sort of thing, and then tell you it's not a problem, they're lying to you. Works great in Florida, by the way. Is anybody here prepared to say we like having poverty and hunger in the world? I didn't think so. Do you know anybody who's going to say that? Therefore, if we can agree on that, then we're off and running in terms of things we can agree on, but it also is an index of what I want to underscore as a philosophical proposition, as a broad foundation of shared universal values. When we do ethics, we are trying, especially applied ethics in the world. I mean, I run an ethics institute. I'm on call in the hospital right now. I mean, this thing could go off any minute. Right? I'll ignore it for you. But the point is, what we want in a world of complications such as we endure to solve practical problems, then I'm of the view that applied ethics is one of those really useful tools. And one of the things that undergirds it and makes it possible is the idea that overarchingly, with a few exceptions, which we sometimes are able to manage, we share the same values. Doesn't matter where you are, how old you are, what your gender is, what race you are, what country you are, etc. I mean, even for all those undocumented transsexual communists that we're so worried about in Florida, of course, we're worried about them everywhere, you understand. But against that, because that's just kooky, we have among ordinary people the idea that poverty is not something that after 10,000 years of civilization, we should still have so many people struggling with. Hunger, especially hunger in children, good health, education, gender equality. If you're in one of those countries that says we don't want girls and women to go to school, that's not a quaint local custom. That is a bold-faced moral mistake. That what you also just learned from me. Any other philosophers here? I am not a moral relativist. I believe that we can know things about how we ought to be in the world in the same way we can know things about how to send signals or how to communicate or how. Most of these, I need a special effects budget for next year, okay? But you see, or how to make computers work, right? We are able to say this behavior, this action is always going to be wrong or always going to be right. If there are exceptions or puzzles or weird dilemmas, well, we can address those as well. But overarchingly, for most of our daily lives, to say that poverty should be eliminated, there should be no hunger, we should all enjoy health and well-being and have a quality education and enjoy equality no matter our gender, etc., ought not to be thought to be saying anything controversial. And at least in the United Nations, we have people from around the world agreeing on these things. Agreeing on these 17 was really quite difficult, but they did. Fast forward now to the problem that is our topic today, namely that we also know that you humans, you should have told them, on my home planet, we don't have any of the problems you all have here. We've sorted all of this out. You all, for some reason, you earthlings, continue to enjoy discrimination on the basis of race, ethnicity, religion, gender, sexual orientation, or age. And I want to share a few thoughts with you to help you think through this. The word bias itself is tricky because if I were to say to you, I'm biased in favor of people who feed homeless people. Is that a bad thing? I don't think so. I just read there's a restaurant in some fancy restaurant in London where all the staff have at one point or another been homeless. The chef who's got a Michelin star apparently had a substance abuse disorder. He managed to get it under control about the day the restaurant opened. Right? If I say I'm biased in favor of people who tell the truth, I'm biased against people who do human trafficking. You see the point. Bias implies discrimination without credible basis. All right. And I want you now to think of 3 sentences which bias seems okay. I just gave you 3 myself. You can do it later. Can we have a test later? Dr. Bern-Klug, I don't know how that works.
Sure, we can set up a test.
Okay. Is age-based bias ever permissible? Now, probably what you're doing, because I've just challenged you, you're thinking, well, hang on, could there be a positive age-based bias? And generally speaking, and there's going to be a good exception here in a second, generally speaking, only if you are associating age with a disability. which is not an inference you ought to be making. One of the first forms of bias we say is, well, she's over a certain age, he's a certain number of years, therefore I'm worried about his cognition, or I'm worried about her reflexes, or right? As after a point, I became worried about my mother's because she insisted until she was nearly 90 on driving a car. And I said, Mom, we'll get you taxis, right? Because I actually saw some of her reflexes declining, but I saw her reflexes declining. The point, of course, is in the absence of empirical evidence, the association of age with infirmity or frailty or incapacity is a form of unacceptable negative bias. Judge people on their merits, not based on their membership in a class or a group or a cohort. Okay. Is there an exception? Would it might ever be permissible to discriminate against people based on age? So here are the hard cases for you. We had this during COVID. Suppose, for example, hey, Allie. No, I just saw you, Allie. Allie, you can't hide from me. Allie Eversole. Allie, I'm going to hypothesize that you are under the age of 30. Is that okay?
Yes, that is true.
Are you under the age of 25?
I'm 24.
Okay, good guess. Now suppose it's in the middle of COVID. I don't look it, but I'm 114. Suppose Allie and I show up at the hospital at exactly the same moment with COVID. We both need a ventilator. Allie's 24. I'm 124. I just raised my age 10 years to make it easy. If Jimmy Carter lived to be 100, then I'm down. And you suddenly see the problem. The problem then is, is there a justice argument based on the concept of, can I put this in chat? I'll put the phrase in chat. So now I got my screens all full of this stuff here. Hang on, chat. There's chat. Other homework assignment. Fair innings. Yes, it's a baseball or cricket metaphor. But one could argue without fear of being accused of a negative form of ageism to say, Ken, you've already enjoyed most of your life. The ventilator is unlikely to extend your life for much more, given that you're 124. Allie has her whole life ahead of her. We have one ventilator. We could toss a coin. And if we give you the ventilator and you're dead in a week, then you've got two dead people. If you give it to Allie, you'll be dead in a week, and Allie will be able to get over this hump. I put that to you to say it's a bit of empirical evidence in support of a larger value. And it's an intuition that I think that a lot of people have. And it's one that I challenge you with. I struggle with it. For my institution, my hospitals, we wrote resource allocation policies during COVID. And we try, and age was one of the greatest challenges that we faced, especially if someone's really old and really sick. Another reason you might give it to Allie is just the empirical evidence that somebody with 24 in COVID has a higher likelihood of survival than someone who's 124 with COVID. In other words, it's not age discrimination, simply age discrimination. There's an empirical fact, namely that some young people are going to be able to survive better given their youth. And therefore, to give me the ventilator is to waste the resource. Careful with that. I'm not old enough to remember the influenza pandemic, the 1918 pandemic. I learned something wonderful about that. The 1918 pandemic. First of all, a lot of the people who died were young people. They couldn't figure that out until someone said, later figured out, something, their immune systems are much more robust. They died not of the influenza, they died of was a cytokine storm. Their immune system kicked in that it actually overwhelmed their body. It was so effective that it actually exhausted them. Read up on cytokine storms if you want. I also learned, by the way, this is interesting. After the 1918 pandemic, everybody lost somebody. And somebody wrote in the Ladies' Home Journal, we need to move on. We need to move on because the pandemic is over and we did not focus on dying so much, but on living. In a lot of houses in 1918, you would have a wake, depending on your religion, you'd have a wake, you'd sit Shiva in your parlor. An article in the Ladies' Home Journal said, let's stop calling them parlors and start calling them living rooms. The phrase living room comes from the 1918 pandemic. Okay, enough of that. So is bias the correct term? And the answer is, I think it is. It's understood, especially in the context of artificial intelligence. But I want you to note that the meaning we attach to it is going to be negative and not based on evidence. Okay? And then the question, so what? That's because I'm a philosopher. And I want to challenge you all with the following assignment. When it comes to science or ethics, why do you believe what you believe and not something else? What makes something right or wrong or good or bad or blameworthy or praiseworthy? That's what we do when we do, well, either moral philosophy or in an applied way, ethics. Why is it wrong to Donna, that's a beautiful, beautiful eyeglasses you have. I need glasses. I just got in fact, where's my prescription? If I were to come over and pull the glasses off your nose and put them on my nose, and walk out the door, never to be seen again, I will have stolen your glasses. We all agree that that's wrong, I hope. Why? Why are many of the things that we all agree to be wrong, wrong? What's the why? It can't be our agreement that makes them wrong, because goodness knows, in our country at least, majority of people at one point believed that it was okay to buy and sell human beings. Can you imagine it? If you ever get to New Orleans, there's a museum there. It's on the history of slavery in America and how the laws were designed to protect property owners, including people who owned other people as property. Wow. So we all agreed that slavery was okay, but we were wrong. Women were discriminated, in some cases still, as are Black people, still discriminated against. And some people are okay with that. Some people want to discriminate against immigrants. Or they want to discriminate against people because they're gay or transsexual. I don't get that either. You might as well endorse slavery. So what is my challenge to you about how we want to be able to say this is not a matter of opinion. It's not a matter of I feel so strongly about this. It's just wrong. That's not an argument. That's not a reason. In my world, and I believe in yours, it's about evidence and reasons. Okay, that's the so what point. Okay. We are really excited about what can happen in the world of artificial intelligence for aging and for many other areas of human life and human health. What will you use it for? Why will you use an artificial intelligence program? What should you be mindful of? How can AI support UN Sustainable Development Goals? Once again, I've taken to heart that it is UN Day for an aging, and that means learn what the United Nations is trying to do when it comes, one, to artificial intelligence, and two, to aging, in light of Sustainable Development Goals. In the context of computers, what could possibly go wrong? Okay. Chuck Friedman, an old pal, very famous illustration of his. You all see the picture, right? Would anybody want to volunteer and say what it's sort of it looks like mathematics to me, right? There are brackets and other signs. Does anybody want to volunteer and translate that?
Well, I guess it says in the parentheses, a person with a brain plus a computer is greater than a person with a brain.
Where do you see that?
Well, if I'm interpreting these symbols correctly.
You have provided, Mercedes, the perfect alt text description of the image. A human brain plus a computer is greater, stronger, more powerful than the human brain. Okay.
Yep, that's what it says.
Alt text requires those words to be displayed for people who are not able to see text. In other words, the standard for internet images, if you want to be accommodating of people with visual disabilities, is to provide alt text for all your images. Because if I had a vision problem, I can enlarge. I had a colleague once who had a computer where he literally each letter was the size of the monitor he was looking at, and so he could very slowly read text. He got pretty fast at it, but an image you cannot make out. And providing alt text so people with vision problems can read it is now part of the standard on the internet.
What do you mean by alt text?
That's the name given to putting words next to pictures so people online will be able to read what the picture is of, since they cannot see what it is of. Because if
Well,
I
how
were
can they see
blind,
the words? How do they see, if they can't see, how do they see the words?
because they can enlarge the words enough on their screen. If you enlarge the picture that much, you would focus on a small part of it.
I see.
Right? You can there are computer programs that will basically make it so every letter is as tall as your monitor. If you magnified the image that much, you'd lose all the detail in the image and you wouldn't be able to see what it is of. This is a standard for accommodating people with disabilities. Some people say it's an obligation to provide alt text on the web. Consider whether failure to provide alt text descriptions is a form of bias, where I make the point that does bias simply require that we not do something bad to somebody, or can we be biased against them in a more tacit way? If you want to live in the world, you're going to have to live online. And people who are blind or hard of seeing are not able to make out the pictures. And so someone would argue that if you don't provide that reasonable accommodation, that becomes a form of bias. Okay. So what we've learned about AI and ethics so far, and this has become, as you all discovered, the hottest topic in the history of civilization. And it's been like a couple of years since the first ChatGPT came out. In fact, November will be 2 years. Okay. We've learned that it is biased. It's biased on the basis of gender, biased on the basis of race, biased on the basis of ethnicity, because the training sets that were used for the computers to learn in machine learning, those training sets were not representative. It wasn't the people who wrote the programs were racists. It was that their data sets represented a fraction of the population. If you do this in healthcare, we know it is a matter of objective observational fact that if you are Black, you have less access to high quality healthcare than if you are white. That doesn't make me woke. That's not trying to complain about to make white people feel bad. That's a brute fact. Anybody who says otherwise is also trying to lie to you for some weird kooky political purpose, I reckon. But the point is, if it's biased, we still need to fix it. We're concerned about safety. When should you use a new technology? That's not me barking, although I sometimes do bark. If whoever is got a bark.
Sharon, please mute yourself, Sharon.
Oh, don't call anybody out.
I didn't say anything.
Damn dog's making more sense than I am. We want to make sure it's safe. We do a lot of testing. Anybody involved in research knows that before you can do a new drug, use a new drug or a new device, you've got to test it in animals. No offense to the pets online. We test it in people to determine its safety and its efficacy. Have we done that with artificial intelligence in the hospital yet? Have we done it with artificial intelligence and aging yet? No, there's no randomized double-blind placebo-controlled trial yet. We're just adopting it. So one of the things we need to be concerned about is safety. Is the process by which the code was written and the system is built transparent? Are we able to explain? And if not explain it, can we interpret it? Some technical questions there in artificial intelligence. We can get back to them later if there's time. We need to make sure that the people who are building the systems, writing the code, installing them in our institutions, are hewing to standards of accountability and responsibility. These are not synonymous. You might be accountable for something, or if, for example, it may be my duty beforehand to make sure that my pen doesn't go missing. If it goes missing, then I'm responsible. That's right. It's a subtle distinction, and we try and make that necessary. And then last, governance. What regime, what mechanism, what rules do we want to put in place to make sure that these new exciting tools are unbiased, safe, transparent, explainable, accountable, and responsible? Institutional policies, professional organizations, governments, all sorts of opportunities to get this right. Okay. There are other considerations I mentioned in passing. You know, by the way, that artificial intelligence uses a great deal of electricity and a great deal of water. It turns out Microsoft, did y'all read it, 3 Mile Island? Microsoft is buying a nuclear reactor. Private corporation with its own nuclear reactor. What a concept. The amount of energy it takes, you can find these statistics, the amount of energy it takes to answer the 1 day's worth of ChatGPT queries would power a city for a day. A lot of energy, a lot of water. And also, with all due respect, a lot of greed. This is what's called a digital sweatshop. This one happens to be in the Philippines, where they basically pay people small amounts of money to tag the pages on the internet that are used to train for the training sets that the AI algorithms are tuned on. I mentioned it in passing because we want to get this right. We want to make sure we don't. This will be one of the most important points I make at the end. Do not make existing disparities worse. Okay. WHO, like the UN, both essential and a really big challenge to deal with sometimes. WHO just can't win for losing. And that's because it has to make everybody, it has to make the Chinese and the Americans happy. It has to make the Iranians and the Israelis happy. It has to make the sharks and the jets happy. It is a very, very difficult proposition. But a number of us who believe that it's better than the alternative and have committed a lot of effort to supporting the WHO are convinced that this kind of work matters. And Dr. Bern-Klug, you were generous in mentioning my work on this. I was a reviewer of this document and a number of other AI documents that the WHO has been working on. Ageism examines the use of AI in medicine and public health for older people. Older people. Now, there's a euphemism. When does one become an older person? Allie is an older person if she's in the room with a bunch of teenagers. But I don't think I would think of Allie, and neither Allie would think of herself as an older person. Point is, it's imprecise. And the lack of precision sometimes leads to bias. Exacerbate, worsen, or introduce new forms of ageism. This is this brief. It's a brief. They call it. Legal, non-legal, and technical measures can be used to minimize the risk of ageism and AI. Okay. I'm not going to read the two. So I hate when people have slides with text and then read them. So what I'm going to do is I'm going to shut up for 30 seconds. I can read it in 10, I bet. But I'm going to just pause for a moment. And also sneeze, maybe. making clear that the bias we don't like involves prejudice, stereotypes, discrimination based solely on the stereotype, right? If we discovered that women are better than men at flying spaceships for whatever reason, then is it okay to prefer women as spaceship pilots? I can't see the whole room here. Let me try and expand this. Are there any men under the age of 25 here? Allie, do you have any friends your age here? No, I don't have not enough pictures. The reason I ask, of course, is if you're a man younger than 25, they're never going to rent you a car. Do you know why they won't rent you a car? Because men under the age of 25 are famously irresponsible in motor vehicles. Now, not you or not me or not my brother or my best friend, we're perfectly responsible. But the epidemiology of it is clear. Young men do stupid things in motor vehicles. No, I don't mean to be like anti-young man. I'm not an anti-young man ageist. But if I ran an insurance company, I don't want to lose money on you. By the way, if you're ever wondering about something, about whether discrimination is permissible or not, find out what an insurance company will cover. You know why insurance companies want universal health care? Because it saves them money. Oh, hope that's not too woke either. Civil society has health care for everyone. That's not woke. That's civilization. I hope that's not controversial. So you see the idea. We've got with ageism, however, when it is negative, undermines the life of people, of our elders, makes it more difficult for them to get along, deprives them of certain rights and liberties, and very often constitutes a form of neglect. On analogy, you could argue with the alt text example, namely, let's not wait for people to ask us. Let's learn what it is they need and then help them. This is especially true for people with disabilities. By the way, the association of old age with disability is another problem. It is a form of ageism, and I think I made that point. The next thing I wanted to ask you to look at is this. I'm going to be quiet again. Geron technology is your new word of the day. If anybody says, "Did you already new words today?" You can say, "Yep." Thanks to Drs. Bern-Klug, she got this boffin from Miami who taught us Geron technology. I can't pronounce it. Right? This may be a way both to make age-based stereotypes worse or to mitigate against them. And that is the nexus, the thrust, the core of what I want you to come away with today. It would be irresponsible to say, I don't care about this AI, it's biased, I'm going to leave it alone. There's reason to believe that proper use of AI will improve healthcare. In which case, the problem then is if you have evidence that something will improve healthcare, it becomes blameworthy not to use it. And that is a delicious challenge. Oh, hang on, did I skip something? No, there we are. I want to frame what I think these are obligations, and I think they're not controversial. The first obligation, if you work in healthcare, if you're a human, if you have family members, if you ever gotten sick, anybody here ever get sick before? Yeah, right. Is anybody here old or going to get old, you hope? Yeah, it's all of us. Good luck and Godspeed. I hope you all get really, 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 really old eventually. Learn more. Learn about the problems with aging. Learn about the opportunities and challenges with AI. For our purposes today, once again, signaling the very cool work you all are doing in terms of the United Nations. Learn about Sustainable Development Goals. Attend to the risk of negative bias. It's not going to magically be cured. Sometimes we think we fixed our databases, our data sets, and we haven't. This is a demand for ongoing analysis of our tools, the way any good user of tools does that. You know, if you have a carpenter and she realizes that her saw has gotten dull, well, she's not going to be a very effective carpenter, is she? You have to sharpen your tools. And that, I think, is something, argument for lifelong development, if you will. Manage, mitigate, and eliminate such biases. Okay. Do not worsen disparities. We know there are disparities. There's no ethical defense for the idea that some people have more and some people have less, or for some people it's good, some people it's bad, based solely or largely on their age or their gender or their race or their ethnicity or their religion, etc. And then show your work. Sorry, I was a substitute teacher for a while and I did math. Back before ChatGPT would do your math for you. And of course, what you had to do is, I know you got the right answer. I want to know how you got the right answer, right? When it comes to writing, I have colleagues who are going back to blue books. Have you ever seen a blue book? But I've taken where the exams are in class and you have to write it out longhand, because otherwise everybody's going to use ChatGPT for their essays. We can have that a debate for a separate day. And then also, as you're doing this, we are of the world in ways that I think are interesting and exciting. So I was doing a little research. Turns out that the population of people 60 and older in Johnson County, Iowa, is 20% of the population. Now, I don't regard 60 as old. Passed that one a while ago. On the other hand, I'm not delusional about this. Do I need? I also know I have colleagues and friends my age who are not as shall we say, who need more help than I do. Okay, so in your county, you've got a non-trivial. That's 20% of the population, right? That's 1 in 5 people. And I said, well, hang on, what about poverty? Okay, far fewer. Johnson County seems to be a pretty affluent county. Am I right about that? Compared to many standards. Good for you. Share. Right? In other words, one of the things that makes that I'm gonna go all patriotic on you. One of the reasons why we love our country is how when we realize we've got a problem, we set about the task of fixing it. And since you agree with me at the beginning, thanks to the UN, that poverty should be eliminated, let's do our best to make it so there aren't poor people, especially poor old people, because after a certain age, you are what our colleagues in the research world call vulnerable. In other words, the vicissitudes of life have a greater effect on you year by year by year. Right? And that matters. It means that you're vulnerable. What counts as a vulnerable population? Children are vulnerable. I'm sure I given the earlier point, if you're worried about poverty, to make sure that more kids are getting fed, right? But in fact, we have the resources to bring everybody to that level. That's not Stalinism. That's not woke. That's not politically correct. That is a bold-faced moral obligation of civil society. I'm hoping somebody disagrees with me. We'll have a wonderful exchange in a minute. But you see the point. By the way, the Data USA, the Johnson County profile barely mentions Asian. I had to go to the US Census to do it and to actually get these data, which is why the colon follows the second URL, right? When I say pay attention to, attend to, show your work, that requires some science. It requires, what does our community look like? Who are the people in our community? What are their needs? Why? We just want to live in a community where there aren't, I live in a community in Southeast and Miami-Dade County where when they have food banks, thousands of people show up to get free food. There are children who are hungry in America. Don't tell me that's okay. Their parents should have made better investments. Or you don't want the big nanny state to come and start feeding babies so they don't die. The amazing things that politicians get up to. Okay. Now what? it's sort of an algorithm. And it's sort of what I do, when I'm in the hospital, and I would say I'm a philosopher. I'm not licensed to practice anything, but my colleagues still ask my advice in really tricky cases. What are the facts? If there's a disparity, is it acceptable? If not, can AI help? If so, how and with what risk? Therefore, what's the best answer? You sooner or later you have to make a decision. You're not required to be infallible, but you are required to be cautious, to avoid negligence, recklessness. And when we do this, the history of the world shows more often than not that we get it right. That requires data. That requires science. That requires supporting the scientific mission and avoiding scientific kookiness of the sort that seems to be rampant in our fair and beautiful country. What are the facts? What can be done? What should be done? Why? That's an ethics algorithm. The why part is what we do when we do philosophy, when we do ethics, namely, the reason why human rights matter is because unfairness I could be in that state myself one day. If you like, it's the philosophy of Immanuel Kant. If you twist it a little bit, you get the golden rule. The golden rule. What a concept. If only the legislatures of Iowa and Florida would make it a law. Treat other people the way you want to be treated. Most people are starving saying, but I like starving. Avoid kookiness in your deliberations. To recap, we have the aging population in the United States is expanding dramatically. We know that elders are a vulnerable population and they sometimes need more resources and more help. It's possible that artificial intelligence would be able to provide either that help or better ways of providing that help. Under all of our noses and all of our communities are populations that are vulnerable and which I think are entitled to that additional bit of support. Once again, that's not a political observation. That's a moral conclusion. And by the way, does anybody know of any great religious tradition that says, we may say the poor will always be with us, but not that we do not have a duty to help them? I think that's uncontroversial. And I love it when I can manage to say some of the things I've said and be able to conclude with two things. One, to thank you very much for including me, and to say, I do hope that what I've shared has been uncontroversial. So according to my clock, we have just as much time as you promised, Dr. Bern-Klug, for comments, questions, and protests.
All right. So if people want to put any comments or questions in the chat box, or if you'd like to unmute yourself, please go ahead and do that. As people are thinking of their questions or putting them in the chat box, can you clarify what counts as artificial intelligence?
Arthur C. Clarke, the guy who wrote 2001, is famously quoted as saying, given a certain level of one population, any sufficiently advanced population will be able to do things that the first population thinks is magic. If you're playing shortstop and the ball is hit to you on the ground, then you should catch the ball, and then you should throw it to first base. That's an if-then statement. If-then statements are very, very brief, simple algorithms. In a computer program, we get lots of really complicated algorithms. So, for example, actually one of the first artificial intelligence programs that learned to play chess, not because they were smart, but because they were able to analyze millions of moves. There's a game called Go, an ancient Asian game, and it figured out how to play Go by making millions and millions of mistakes. So artificial intelligence is a computer program where the program learns. So, for example, if you know the rules of the game of baseball and you're a shortstop and the ball is hit to you and you don't try to catch it, you've made a mistake. If you do catch it and stand there admiring your beautiful catch, you've made another mistake. When that computer will learn the rules of baseball. So to the point when you get really complicated examples or large data sets, then you're able to use this computer program to learn from the from data, namely our past documented experience, and be able to give you guidance. Some of the artificial intelligence programs do diagnoses. You put in signs, symptoms, lab values, and it will tell you what you've got. It will give you, if there are any nurses, there are nurses here, I hope, yes?
Yeah, there's some
Okay.
nurses here. Yeah.
So I want you to think about nursing diagnoses. I want you to think about differential diagnoses with probabilities next to them. AI programs can do that. Now you can do that too, but when the computer does it, it's lines of code that are translatable, if you will, into really, really complicated if-then statements, such that as it encounters new data, that changes its understanding of what it needs to do as part of the then. That's one way to think of it. They learn, which is not what it's. I think learning is a metaphor here. Learning is something that humans do. I think we use it as a metaphor in the context of computers, frankly. But artificial intelligence tries to replicate what humans can do when they use their heads.
Good. Oh, thank you. I just
AGS,
wanted
the artificial intelligence is no match for human stupidity.
Thank you. Does anybody else have a question or a comment? Ryan, you opened up your video, your camera. Do you have something you want to say?
No, just thank you. This has been really intriguing and thought-provoking.
Also, one of our aging and longevity study students put in the chat box that she likes the platinum rule too. Treat others how they want to be treated. Thank you, Elena, for adding that.
Even better. Even better.
Thank
Unless
you.
of course they're masochists. Like, what do you do then? But you get the idea that one of the foundations of a lot of moral philosophy turns on the question of what it means to treat other people with respect. The rule for the philosophers, all the philosophers in the room, you will know fireflies.ai. Is that a robot who's listening to me?
I don't know.
See what makes of that. One of the ways we treat people with respect is not to use them as means to an end. Don't use people. Right? But I can make a lot of money, and I got Donna's glasses. So what do I care whether I've used her or not? I needed a pair of glasses. In other words, everybody can see based on the words that I've used, that I've employed, I don't want to use the word used twice, that I've done something wrong because I have treated somebody as a means to an end and not as an end in herself. And according to a lot of philosophers, to do that is the height of irrationality. To hurt other people, to use other people, to disrespect other people is irrational. Why would you want to do that if you are greedy or selfish? And now you begin to see how philosophers try and think about these things. We're not holding hands in a circle and getting in touch with our feelings. We're saying we have a very complicated, fraught world that is shaped by many disagreements. We need to find universal standards of good and bad and right and wrong. And I think the history of the world is a struggle to get there. Philosophers say critical thinking is how you get it. Many people in different faith traditions say their scripture gives them the answer. Right? But a thousand flowers bloom. But if you're reading your holy book saying don't educate women, See, the problem is you humans, let's get on my home planet, we thought we all have had 10,000 years, and you still don't agree on the one true God. What's your problem? So we disagree about scripture. Anybody who says, I want my country to be a blank nation, Zoroastrian or Hindu or Arapaho or Jewish or Muslim or Christian, why would you want that of your country? That just doesn't make any sense, especially in the United States of America. Have we learned a lot from Hindu, Arapaho, Christian, and other values? Yes, we have. In our hospitals, we teach people about St. Augustine's rule of double effect. I teach medical students about Catholic moral theology because we've learned a lot from Catholic moral theology. Thank you very much. What what makes it right, with all due respect, is the arguments. Remember, Augustine, Aquinas, these guys were scary, smart philosophers. And the reasoning behind it, it's not because I said it, it's got reasons underneath it. And those reasons are really good. Demand evidence, demand reasons. Challenge it, challenge the credibility of the reasons, challenge the science if it seems like it's open to challenge. But at the end of the day, our moral responsibility as regards the use of artificial intelligence in an aging population is to attend to this, to learn about the tools, to learn the scope of the problem, to find the best way to apply these tools to addressing these problems. That's not controversial. That's what humans do when we are at our best.
We have a couple questions in the chat box. Somebody mentioned they're concerned that AI places older populations at greater risk for identity theft.
So one of the things that is a real problem, if you could catch all the people who send you spam texts, spam emails. The mother of a friend of mine got a call with a recorded voice. She thought it was her grandson. She said, Grandma, I've been in an auto accident in Mexico City. Please send me $2,000. You click on the wrong link. They've copied they're into your computer and they're stealing your identity. I might make an exception about my objection to capital punishment for all of them. That's what AI, all technology makes criminal activity easier. Telephone did. People were doing these scams. Some of these scams go back hundreds of years. Because now they're online. Now they're on the telephone. So the answer is artificial intelligence can be weaponized by bad people to do bad things. That's why I want really, really strict laws. We don't have strict enough laws.
I guess our last question, given our time, is somebody's wondering, do you think AI will eventually take over healthcare?
When should we tell them that I'm a robot? Only if we let it. One of the things about nursing and social work and medicine and dietary sciences is we teach humans. We license and accredit humans. Humans interact with humans, and that has created, certainly in our country, a really quite efficient a healthcare system that helps a lot of people when its best is both efficient and useful. Computers are not there yet. It won't take over, but the tension is this: what's an appropriate use, and who is an appropriate user of the technology? Right? Other tools have already taken over healthcare. Right? My school of nursing has a simulation hospital that is amazing. They all have these mannequins, and now they're writing AI programs for the mannequins and all that sort of thing. Right? Are they taking over nursing education? No, they're tools for nursing education. It will only take over if we surrender our responsibilities. And I don't think that that's going to be easy to advocate for.
Well, it's 4 o'clock.
Thank you so very much. It was a privilege. I thank all of you for being here, and I thank you for including me, and for, especially in the context of the United Nations, given how much opportunity we have to do a better job getting universal health equity, the elimination of poverty, and the elimination of war. Take care. I'm too old. See ya.
Thank you. Thank you very much for sharing your insights and your experience with us. And I want to thank everybody for being with us today. We'll be posting the recording on our United Nations Association Johnson County chapter website and the Aging Studies program. So thank you, everybody, and happy birthday, Jimmy Carter.